Hello, thank you for joining me today. We are going to be discussing how you can optimize clinical care through physician engagement. My name is Allyson Watts. I'm an RN with over 15 years in healthcare experience. 10 of those years I've served in various clinical leadership roles, including CNO. I have experience in cardiovascular, orthopedics, surgical services, emergency medicine, pediatrics, and telehealth service lines. I am very passionate about developing programs that can reduce risk and improve clinical outcomes, all while increasing the satisfaction among patient, provider, and clinical staff alike. On our agenda today, we're going to be discussing co-management and why it works so well, tying this to value-based purchasing, and how you can achieve the triple aim of joint care with the 7 best practice standards, all while learning how you can strategize and standardize the care that's delivered in your healthcare setting today. Co-management creates a partnership with physicians to improve quality and patient outcomes through a shared vision. Have you ever felt that the goals that you have as a healthcare leader to improve quality and patient care is different than the goals that the providers have to also provide that excellent care to patients every day? Oftentimes, there's a vision to improve the care, but it is not shared through the same tactics to achieve that care together. Through co-management, hospital and physicians are able to take an active role in the operations of their service lines, and physicians are incentivized and receive compensation that is based upon predetermined quality and efficiency goals between the hospital and those providers. These physicians do not need to be employed by the hospital, as they are strategizing and working to improve patient care throughout that healthcare system. Typical co-management agreements are surgical services, cardiovascular, obstetrics, gastroenterology, and many other service lines that are impacted by value-based purchasing today. A deeper dive into why co-management works so well. It truly is that shared vision that happens between the healthcare leadership team and the providers that are entering your system to provide care to your patients in your community. Co-management provides a venue that is conducive to collaboration. It is well understood that those doing the work are part of the solution, and that's the way it should be, so that we can assure that the quality and patient safety goals that we all aim to achieve are happening through that shared vision. Through co-management, solutions are developed, but they're also able to be measured for results so that we can assure the steps that we are taking are truly impacting the quality and safe patient care that we all aim to achieve. You should know that understanding the problem always comes first. Through consultant support, the co-management agreements between the hospital and the physicians are truly able to understand why things are working the way they are now and what steps they will need to take to help the hospital improve patient outcomes through strategizing and standardizing that patient care together. Most of you have heard about value-based purchasing and how that will impact the ability for your hospital to be reimbursed for the quality, efficient, and safe care that's delivered. You should all know hospitals are no longer being paid solely on the quantity of those services provided, but instead on the quality of those services. CMS has broken down the quality of that care into 4 areas that can be measured, and every hospital is scored based upon how well they perform in the areas of safety, clinical care, efficiency and cost reduction of that care that's delivered, and patient and caregiver-centered experience and care coordination. This is an example of how one orthopedic service line was able to improve patient care and outcomes, aligning with value-based purchasing through the 7 best practice standards that are essential to every hospital and provider that is trying to decrease cost, reduce complications, and also provide that safest and highest quality care possible for their orthopedic patients, every patient, every time. Here I have highlighted the 7 best practice standards. In the next few slides, we'll discuss those more and how they can improve patient outcomes and quality care for orthopedic patients. And now an overview of those 7 best practice standards and how they can truly impact the quality of care that's delivered to patients receiving orthopedic joint care in your healthcare setting. Best practice standard number 1, TXA, tranexaminic acid. Administration of tranexaminic acid preoperatively results in less blood loss for patients that are receiving a total hip or total knee replacement. And this ties directly to best practice standard number 2, which is no blood administration. Blood transfusions can cause more complications and increase the length of stay and produce a much longer recovery period for those patients that have received a total hip and knee replacement. Best practice standard number 3, ambulation on point of day 0. This truly means activity on the first day. These patients that are receiving a total hip or total knee replacement are expected and able to get up and ambulate postoperatively on day 1, which we all know activity is the step 1 to a speedier recovery and better patient outcomes. Best practice standard number 4, no IV opioids, point of day 0. Patients that receive IV opioids suffer from side effects such as nausea, vomiting, and urinary retention. These side effects slow down recovery and also impact their ability to get up and ambulate and start to recover from their postoperative procedure. Moving on to number 5, length of stay less than 3 days. When all of the best practice standards are followed, patients are not getting out sooner because it's more efficient for the hospital. They're discharging home because they're actually better and ready to go home and finish their recovery. Best practice standard number 6 is discharging that patient home. There's much research and evidence that demonstrates and shows that patients are able to recover faster and better in an environment that they are familiar in and also surrounded by caregivers and family members who can support their recovery. And the last best practice standard, regional anesthesia. When the orthopedic surgeons are placing regional anesthesia blocks, they're able to control the patient's postoperative pain better. And this is why patients do not require those IV opioids postoperatively and are able to get up and ambulate and feel much better and ready to recover following their postoperative procedure. With co-management, we have learned it's all about the journey. And so have our orthopedic surgeons who have learned to hardwire these best practices by learning the barriers that needed to be removed. They developed a pathway to excellence together. Think about the quality metrics that you are working on now. And can you truly say this is how you would describe your successes today? Well, let me tell you how the surgeons were able to achieve these quality metric and safety goals through co-management. First, they reviewed literature. It is expected that as evidence-based practice changes in healthcare settings, it needs to be backed by literature that supports this is the practice and care that should be provided today. Once the surgeons are able to identify what that best practice is, they bring that literature to the table, where the team collaborates and identifies what barriers need to be removed so that we can implement this care. From there, the surgeons are able to work with the hospital leadership and administrative help to publish new policies and change order sets to reflect the best practice evidence-based care that should be delivered to the patients in their service line. From there, the surgeons are able to see how their plan can be measured for results. Is this work truly improving the care that we designed to deliver better patient outcomes, improve safety, while reducing costs through efficient standards? The surgeons and the healthcare team are able to look at regularly reported results and all the while sharing those barriers and also reporting the successes along the way. This is an opportunity for the surgeons or the other physicians in various service lines to collaborate and communicate with the rest of the healthcare team what is happening, what is changing, and assuring that education is provided to all stakeholders. And this also is how it is hardwired within the system, and the best practices are able to be followed every time. So what I've described today is a shared vision equals a shared strategy. By aligning the hospital strategy with the physicians, this is when you are truly able to build a shared vision. From there, you can achieve goals based upon what is actually happening. There's that opportunity that we all need to have to break down those communication barriers, build trust, and reach those quality and patient safety goals together. I'm going to share with you some other results that we've been able to obtain while collaborating with healthcare providers and hospital leadership teams. In one hospital, we were able to see an improvement with HCAHPS physician communication scores up to the 98th percentile. While 92% of the total joint patients were able to be discharged home, and operational efficiency was improved by 125%. By improving first case on-time starts, and also reduction of the length of stay to 1.25 days for these patients. And most important, through collaboration and co-management and improved relationships with the healthcare setting and the providers providing that care to patients in your community, staff satisfaction had improved all the way to 95%. Another client shared the ability of Dynafios team to work with our physicians, and coupled with the experience, were key in helping us successfully transform our cardiovascular service and recruit new physicians, and this is simply the best. We all know that physician recruitment and retainment is critical to be able to provide access to the patients in your community that need that care that you can deliver. Through co-management and collaboration and better relationships, we're seeing these physicians satisfied and wanting to stay, and even hoping to see other providers join their team so that they can continue on this journey together. Do we have any questions? Amy has a question, and Amy's question is, what are typical barriers that I see when I enter the co-management agreement between the hospital and the providers together? And Amy, that's a really great question. One of the most common barriers that I run into as we're establishing this opportunity to improve relationships between providers and hospitals leadership is communication. I truly see that both sides want to improve care. They want to see the best quality delivered to every patient, but they have different ways of aiming and achieving for those goals to occur. So the first thing that we often have to do is break down those communication barriers, and that's where we're able to develop that shared vision that really truly sets that new pathway to clinical excellence. Are there any other questions? John has another question. Yes, John. So John wants to know if he sees the frustration that often occurs between the providers in the healthcare setting as they're trying to provide care and the leadership team, because they have different goals they're trying to achieve. And this is also a really common thing that I do see, John. And again, it all ties back to breaking down those barriers and improving that shared vision or I should say developing that shared vision. So we take those quality goals that each side has, and as we lay them out, we're able to identify that they're much more alike than not, And also, when the providers and the surgeons that are out there delivering that care have things that they need, those resources and tools to do their job, they are able to identify that they have to be part of that team, and they have to work with that healthcare leadership team as they strategize and identify what do we need to do now in order to be able to achieve what we need in the future. And so I do see frustration that does come from misaligned communication, but definitely not misaligned goals. I'm working with people, I'm very fortunate too, that their goal truly is to improve patient care and outcomes every day. Thank you, that was a great question. Well, I wanted to thank you again. Please feel free to reach out via my email or my phone contact number if you have any further questions, or if you would like me to visit your hospital so that we could further discuss how you can improve patient care and outcomes and align better with value-based purchasing.